The Quaid Twins. Dennis Quaid and his wife Kimberly suffered through 5 miscarriages before finally turning to a surrogate to carry their twins. When the twins were 10 days old, they were admitted to the hospital for IV antibiotics. While the twins were hospitalized, they suffered a near catastrophic medication error. The twins received 2 doses of heparin 10,000 units instead of the ordered 10 units of Heplock. Quaid reports that up to 100,000 people die every year in hospitals due to medical errors and states that healthcare harm is the result of the failure of the system. As a result of this error, Dennis Quaid and his wife, Kimberly, launched a foundation in 2007. This foundation merged with TMIT in 2010, and their focus is to raise public awareness about the broken healthcare system and to eliminate human error. Dennis Quaid became an advocate and international champion for patient safety, speaking at the International Forum on Quality and Safety and to the National Press Club. He participated in the making of the Discovery documentary Chasing Zero, Winning the War on Healthcare Harm, and has collaborated with Dr. Charles Denham and published articles focused on patient safety and quality. Chasing Zero is an initiative to reduce preventable harm and medical errors to almost zero. Dennis Quaid and others who have been affected by trauma or tragedy start their story talking about the victims. This gives the storyteller the opportunity to introduce the person and allows the audience to get to know and understand the story on a personal basis. Heparin is an anticoagulant used in the prevention and treatment of blood clots. Heparin lock is an IV flush used to maintain the patency of an IV catheter. The side effects of heparin is mild pain, hematoma, hemorrhage, local irritation, erythema, and injection site ulcer. Normal pediatric dosage for catheter patency for infants under 10 kilograms is 10 units mLs and still enough volume to fill the lumen of the catheter. During 2006 and 2007, 9 neonates received potentially fatal doses of heparin. In the Quaid Twins case, they received 2 incorrect doses of heparin. Signs and symptoms of the overdose in the twins included bleeding and hemorrhaging from puncture in IV sites, pain, and severe bruising due to internal bleeding. The appropriate intervention is to administer protamine sulfate, which is a drug that reverses the anticoagulant effects of heparin by binding to it. Applying pressure to any bleeding sites, administering IV fluids, and blood transfusions may also be necessary to help stop hemorrhaging. This medication error was a result of a faulty labeling of medications. The adult vial of heparin and the pediatric vial of Heplock look almost identical. They were the same size and shape. They each had a blue label with a slightly different shade of blue. The similarity between the vials contributed to the wrong dose being administered. The wrong dose may have been given twice because there was no medication administration system to prevent these issues. Barcode scanning systems can alert nurses if the wrong medication or dose has been scanned prior to administration and can detect and prevent errors from reaching the patient. Nurses should not rely on the barcode system alone. They need to be conscious of checking the bottle from which they are drawing up medications. Reading these bottles carefully would have alerted the nurses that it was not the correct dose of heparin. After the problem was detected, the hospital never notified the Quaids about the error or condition of the twins. When medication errors occur, they need to be detected and reported immediately so that an attempt can be made to correct the issue. It is also necessary to alert the patient and/or family that an issue has occurred. Once the error was identified in the twins' case, the doctors should have called the Quaids to tell them of the situation. The doctors may have been hesitant to notify the Quaids because of Quaid's celebrity status. The healthcare team may have been hoping that they could correct the issue before Quaids found out in hopes of preventing the situation from going public.
Empowerment is an educational method planned to help patients and families develop the knowledge, skills, approaches, and self-awareness required to assume successfully responsibility for their health-related decision. Partnership between nurses and their patients and families empowers patients through an active involvement in their own care. This partnership involves clear communication between healthcare providers and patients and emphasizes collaboration in order to reach common goals. Patients are encouraged to identify opportunities to learn and sustain healthy behaviors. Patients and families can be empowered by providing information about their illness, answering patients' questions, and explaining the clinical tasks before they are performed, so that the patient can't interpret that as a power imbalance in the patient-nurse relationship. Education must be given free of jargon, and we must allow enough time for patients to make informed decisions. Nurses need also to be empowered to practice patient and family-centered care by their leadership. Organizational leadership needs to foster a culture that promotes patient and families' empowerment, which will delineate nurses' work structure and priorities. Nurses need to be given autonomy, need to be encouraged to understand their contribution to patient education and care, and to advance their education. Anticipatory surveillance is the early detection of signs and symptoms of complications along with effective response. The nurse is often the first to notice a change in patient status, so our role is vital. Our role is to assess our patients frequently and communicate promptly any changes we notice. We need to spend the time with our patients and get to know them and their families so we know when a change has occurred. We need to listen to our patients, avoiding misplaced professionalism. Our patients and their families know when something is wrong. We need to know risk factors and prepare appropriately for them, placing anticipated emergency equipment nearby or at bedside. We need to do our risk screens for falls, DVTs, pressure ulcers, infections, etc., so we know how to better treat our patients. We need to use technology to our advantage. It's our safety net. Scan your patients, scan barcodes, and program smart pumps correctly. We need to help establish and utilize rapid response teams as a valuable support team to prevent further decline. We need to communicate and advocate for our patients and families with the entire interdisciplinary team. The manager's role is to provide appropriate staffing, appropriate resources, and basic and continuing education. Managers need to promote interdisciplinary communication that extends to patients and families. There needs to be mentorship programs in place where new nurses can learn from the expertise of veterans. There needs to be an appropriate response to poor outcomes. We need to move past silence, blaming, and nurses becoming second victims. To truly learn from these outcomes, we need to create an open forum to share and discuss and make changes.
As we have learned throughout the semester, patients and families are important members of the healthcare team. In the Quaid Twins situation, the parents had concerns about their twins' well-being, and unfortunately, these concerns were disregarded by the hospital staff. There was not any active listening going on with the staff, listening to the family members, and listening to their concerns. There was also a lack of teamwork and communication between the actual staff members. The nurse in the situation had given the wrong dose of heparin, and instead of informing the family about the mistake, seems as if the healthcare team was trying to get the situation under control before having to explain this to the family members. Unfortunately, when the situation is not under control and the family finds out, there is a lack of trust because of the lack of transparency between the staff and the family. Also, the staff, they didn't communicate. They assumed each other was doing their job correctly instead of actually communicating with each other. And of course, there was a systematic error with the medication administration system as well, which contributed to the mistake. But the way that the mistake was handled was the real problem in this situation. If the parents of the Quaid twins had been involved in the care of the twins and the staff had listened to their concerns, there might have been the second medication error might have been prevented, or there might have been a quicker response to the medication error, and there wouldn't have been the broken trust in the healthcare system that there was in this situation. Many healthcare providers and nurses are afraid of lawsuits, and as Polly Gerber Zimmerman stated, nurses are often concerned about committing a wrong action that will result in a lawsuit. In reality, it is often omissions or failing to consistently and thoroughly perform the basic act of nursing that results in a lawsuit. Steps that healthcare providers can take to promote teamwork and patient-centered care could be to educate the staff about the importance of being responsible and accountable for actions, for all of their actions, inform staff that most lawsuits do not occur when a mistake is made, but more so when omissions are made or when other members of the healthcare team are not notified about patient situations or bad patient situations. They could create an environment that the staff is comfortable in where they feel like they're able to speak up and they're able to admit to medication errors or any kind of errors. Or they could have meetings or seminars for staff to attend to address why teamwork and patient-centered care is important for patient outcomes. There are two important aspects of including patients and families in the patient's care. Communication is one, listening is the other. For communication, it's important to keep the lines of communication open, be honest with the family and patient, and develop trusting relationship. Inform patients and family members of what you are doing and why. Explain in terms that they will understand. Discuss care plans with them. Provide them with educational resources. Encourage them to ask questions, and assess that they truly understand what you're talking about, and ask them to explain things back to you so that you know that they understand. For listening, it is what it sounds like it is. We have to listen when patients and family members have concerns and take their concerns seriously. Remember that families may notice a change in patients before you do. Provide good patient and family-centered care by not only keeping the family informed, but listening to their concerns, requests, or suggestions.
Assessing the work environment for areas that could be improved upon and identifying and reporting near misses can improve the overall safety of medication administration and other processes. This may include further advocacy by following the chain of command if a roadblock is met in the delivery of safe patient care. Professional accountability is also a main duty of the healthcare provider, along with a knowledge base that matches the healthcare provider's skills to the needs of their patients. It is essential for healthcare providers to recognize when they need to elicit help from further resources. According to Sandlin 2008, approximately 32.4% of pediatric errors that occurred in the OR were the result of improper dose or quantity, compared with 14.6% in the adults. Errors associated with pediatric medications are a significant cause of preventable adverse events in the healthcare arena. The article outlines a main cause of pediatric medication errors as a result of the use of labeling intended for adult use. Nurses spend a great deal of time interacting and caring for their patients. The valuable information gathered in their day-to-day activities can be crucial to error prevention. When deficits are noted within the system, it is the responsibility of the nurse to speak up and demand fair practices as well as a safe work environment. According to Duncan 2004, nurses deliberately decide to not report some medication errors. It is estimated that 95% of medication errors are not reported because staff fear punishment, including job loss. Emphasis should be placed on improving patient care and not targeting and punishing the individual. This can help to create a safe environment for communication and collaboration in regard to error prevention.
Transparency and advocacy. Establishing a patient-centered care with responsibility, accountability, and authority is the foundation for a relationship with your patient and their family. Open, honest communication is essential to establishing trust and will increase the quality of our care and their safety. Assessing the patient and family of education needs should start at the time of admission and continue for the post-discharge needs. This would include procedures, tests, medications, with their risk factors, any alternatives and interventions, and signs and symptoms that they may experience. Patients and families need to know their providers and their roles, along with contact numbers. Proper resources need to be ready and available prior to the patient's arriving to the unit. Accurate surveillance of the patient with an established knowledge base is needed to carry out interventions that have a positive outcome. Continuous collaboration with colleagues from the time of admission to discharge. I would like to say that our facility has a good surveillance system that is with good rapport, support, and trust with their nurses. After communicating with other colleagues, they can recall experiencing difficulties with requests for a doctor to come and assess their patient. When calling a doctor, we use this SOAP template for communicating our patient's needs. When the doctor doesn't follow through, this creates a lack of trust. The nurse may feel her assessment was not worthy enough for a follow-up, nor is the patient's request. Based on your findings, it may be necessary to call a rapid response for the safety of your patient. Our facility encourages us to report any near misses or errors without blame and input for a resolution to decrease the risk for injury. Once an error occurs, the doctor and management and patient is notified. The situation is followed up by our facility with education, policy, and procedure in order to decrease injury.
System errors are related to a lack of technology or support systems in place to help prevent human error. Individual errors are related to professional accountability. In the case of the Quaid twins, both types of errors occurred. The system errors were dosing vials were the same size and shape, only differentiated by a shade of blue. The pharmaceutical manufacturer had known of previous errors but did not take steps to rectify, and the healthcare organization had no technology in place such as barcoding to help prevent these medication errors. The individual errors in this case were the wrong vials being placed in the wrong drawer, and ultimately the nurses who administered the overdose did not ensure proper dosing. In healthcare errors, everyone is responsible and accountable. Transparency, clearly defined chains of command, and a culture that makes it okay to call for help is important. In the case of the Quaid twins, the hospital had identified the error but never called to inform the parents. The parents felt they had to search for answers, and the hospital was more concerned with risk management. In this case, we must remember full disclosure and nothing less. There should have been open and honest communication that alerted the parents immediately. The hospital should have accepted full responsibility, offered family access to the medical record, offered any assistance needed, and also showed them what steps they were taking immediately to prevent this error from happening again to their children.
Transparency and courage are crucial parts in disclosing medical errors in an effort to learn from them so they are not repeated. In the Faces of Medical Error, Tears to Transparency video, it was stated that healthcare harm is preventable, and if we don't talk about our mistakes, we are doomed to repeat them. One of the biggest assets we have in preventing harm to patients in healthcare is nurses who advocate for their patients. By being a learner, we can help prevent medical errors by using our knowledge and critical thinking skills, maintaining a questioning attitude, learning from prior experience and past mistakes, spending time with our patients and creating a therapeutic relationship, maintaining continuity of care, having effective communication between nurses and patients and also between nurses and coworkers, and relying on our coworkers for safe medication verification checks. These are some effective ways nurses can prevent errors and reduce the opportunity for adverse events. In a healthcare team that pays for performance, nurses play a critical role in assuring the quality of care by serving as the front line of defense to intercept medication errors before they reach the patient. Bad systems create the opportunity for medication errors to occur, but the clinical reasoning process used by the nurses result in intercepting the medication errors before they get to the patient. Clinical reasoning in nursing is a complex cognitive process that uses formal and informal thinking strategies to gather and analyze patient information, evaluate the significance of this information, and weigh alternative options. This level of clinical reasoning is developed through experience and leaves the learner more prone to error. In order to be transparent, we must have process improvement initiatives in place to safeguard and protect patients and families from the healthcare team's inability to recognize a developing problem. After all, the family knows the patient best. Appropriate employee identification badges allow patient and family members to understand the hierarchy of care providers, improving their ability to get help if they are unsatisfied with the care they are receiving. Standardizing bedside report with the use of SBAR and including family members during morning rounds and report increases early recognition of patient problems. All healthcare team members are present during morning rounds. This allows for open communication regarding any concerns about the patient's plan of care. Proactively looking for at-risk patients in the hospital and use of rapid response teams prevent failure to rescue clinically deteriorating patients. Patients enter hospitals assuming the healthcare professionals are watching for complications so that they can rescue patients. Clinical judgment and recognition of patient problems requires skill in assessment and decision making. Nurses with higher levels of education and expertise are better prepared to capture the complexity of the clinical situation before serious complications occur. A low nurse-to-patient ratio increases the amount of time spent with each patient, improving the likelihood the nurse recognizes a decline in patient status. Once complications are recognized, nurses must be able to mobilize hospital resources quickly by calling a rapid response. At times, there are no rapid response teams on nights, weekends, or holidays posing an issue. Creating a culture that perceives calling for help as improving patient safety and implementing a process that clearly communicates essential patient information are key factors in mobilizing hospital resources. We must work to limit factors that detract nurses from rescuing patients. Feeling helpless while a loved one is sick and in the hospital can be a devastating feeling. Dennis Quaid and his wife were ferocious advocates for their twins' well-being, and a crucial medication error that almost cost them their lives still occurred. How can health professionals justify this reality? It would be inappropriate to label what happened to the Quaid twins solely on human error. Policies are put in place to decrease the chances for medication errors and adverse events, and these policies can help eliminate feelings of helplessness families can sometimes feel. While these policies certainly help, utilizing a patient care liaison to communicate with the patient and family can ease fears and foster greater understanding. When the nurse collaborates with the patient and family, they are acting as their advocate. When working with a new patient, family members are an important source of information. In Chasing Zero, Dennis Quaid states, "In order to prevent medical errors, we need leaders who aren't afraid to speak up about failed systems and work to change them using the best evidence. Using evidence-based practice is one of the best ways to be a patient advocate. It gives the patient a chance for the best possible outcome. Healthcare providers should do everything necessary to prevent harm. Nurses are often afraid of the shame that comes along with admitting to error. But by keeping the patient as priority number one, the nurse should realize it is about the patient and preventing the error from happening again. When there is an error or a near miss, nurses must put aside their fears and report these issues promptly to prevent them from happening again. These actions by the nurse show tremendous transparency and courage."
The Quaid twins came close to death as a result of a preventable medication error. Once the error was identified, the hospital failed to notify the parents. Dennis Quaid and his wife Kimberly arrived the next morning and found their newborn babies in critical condition. In order for a nurse to provide safe quality care, they must collaborate and work with others in order to achieve the best possible outcomes for patients. In addition to working with other professionals, it is equally important to establish patient-centered care and collaborate with patients and families. Taking the time to talk with patients establishes confidence that the patient's decisions, concerns, and wishes are being addressed. By creating a relationship of trust, responsibility, accountability, and authority, we are increasing the quality of our care and promoting the safety of our patients. Harm caused by medical errors cause pain and suffering for the victims, families, and the healthcare workers. By initiating patient-centered care into our everyday practice, nurses contribute to the Dennis Quaid's initiative of Chasing Zero. It is important for organizations to put processes and policies in place to safeguard patients and to ensure that patients are receiving evidence-based care. Changing the culture of individuals is equally important. Each nurse must commit to Chasing Zero. By participating in quality improvement projects, we must hold ourselves and other healthcare professionals accountable and identify risks. All healthcare providers are responsible for the success and safety of our patients. We must identify system faults and work together improving systems rather than placing blame. This will promote safe, quality patient care.